सर कोविड टीम को लीड करने का कैसा था एक्सपीरियंस?
So it was just we fell into my lap because we had actually made a new ICU on the ground floor, which was not yet commissioned. And the thought came to our director's mind that we can use that area for screening. So you can just hold patient there with the what was being called there, that upper respiratory symptoms, to know whether they are suffering from COVID or not. And from there suddenly it was decided that why not to make a trauma center as the COVID hospital. So that had a lot of challenges. We had about 50 patients on ventilator, and one of them was a 200 kg man on a ventilator. And all those patients, he had a head injury, and all those patients had to be shifted to the main hospital after creating beds there. And then the whole lot of structural changes in the trauma center, which was started even as the part of the vacation and shifting of patients was being done. And but that was something really challenging because I remember in the class 4 employees, they resigned and went. They
Okay.
wouldn't come, they were so scared. And then interestingly, I realized that uh, trauma center staff and the NDMC Charak Palika hospital staff and all these hospitals which had class 4 employees, they were all living in a colony in Sangam Vihar.
अच्छा.
And then the COVID broke out there. So suddenly all that manpower was gone for the days that they were all affected by COVID. And then some of these class 4 employees, they would not tolerate the PPE, they would vomit in the wards. And the apprehension, nurses were apprehensive. They thought if we go home, our family will get infected. People didn't want to go home. So this was, and then it was very difficult to work in PP. So my rule is, you can't fight these battles sitting in your air-conditioned offices. So I would take twice a week, I would wear PP and take around almost sometimes extending to 8 hours when I was looking after the burn and plastic as well as the trauma center, both of which were at that time converted to COVID hospital. And that was when the people were actually reluctant to do a 6 hours duty in PP. And so the advantage of this was, one, nobody ever told me you don't know what it is like to work in PP.
Right.
Because I would be in PP and I'll go and take rounds. Two, the medical superintendent, the nursing superintendent, the sanitary inspector, the physiotherapist, the dietitian, the electrician, the cable man, they'll all go for the round with me. So I would say that the cable has to run in the ward, because hey, somebody whose only connection with the outside world is a television. So we can't have leaking taps in the ward. So they have to be fixed, bad broken down.
Ground level से ऊपर तक सारा काम करना पड़ा.
And then there would be complaints about quality of the PPE. So when I would go, they'll say, Chief has come, let's give him the best 3M PPE. I'll say, no, give me the worst one you have, the one about which we have most complaints. So I was never caught unaware if somebody would say that the soap is not good, the shoe is not good, this thing is not good. So this actually is the entire philosophy, because no team member should feel that I am being subjected to risks by a person who is sitting in his office and trying to guide me from outside what to do.
Sir, कभी ever you felt helpless? Like, अब क्या करूँ मैं?
Of course, I have felt helpless many times. At the time of COVID, we had an administrative officer in faculty cell, and he went into coma. He was on ventilator. He recovered. I went to see him and I said, "You are doing very well. You are a fighter, and we'll get you out of ICU very soon." And the evening, suddenly he deteriorated and died. And this happened to a lot of people,
Mm.
and then felt helpless when the system couldn't take care of things like misplaced phones, which was not
Oh, yes.
like I would say thefts, but everybody was so scared of handling anything that some of these phones were sent in the trash because the person was in ward. Suddenly he became sick, so he was shifted to ICU because it was urgent, but there was nobody to take care. So we made protocols for that. We would seal the belongings in an envelope and hand over
Mm.
to security and give. We were successful in most cases, but there were still problems because of the very nature that people's judgment was clouded. They were anxious, and they were fighting a disease which they didn't know anything about.